So we're back to business. If you want to find out how our dental program is running these days, stay tuned. Hello ladies and gentlemen, my name is Reza Roudsari. I'm the Director of Undergraduate Education at the School of Dentistry, University of Manchester, and thanks a lot for joining me on the very first episode of the new series of Manchester Molars. Now, although COVID is still with us, but we have started coming back to university and our senior students have started coming back to clinics to see patients. Now we are in week 3 of the academic year. The first week was obviously your induction. Last week we were just gradually easing you guys into the clinic, and this week we had our first AGP session yesterday and it's going on. As we expected, things are looking a bit different at the dental hospital and we are learning as we're going along. And a huge thank you goes to all my students who have been absolutely incredibly professional and understanding, and I can see that you guys are doing your best to make the most of a rather unusual situation. So during the past 2 weeks, I did my best to try to keep you posted of how things are developing on a day-to-day basis at the dental hospital. However, tomorrow, Friday, is going to be my last daily communication and I will revert back to the usual weekly Manchester Molars. Now, before I proceed any further, I also have to say a huge thank you to all the staff who've been working incredibly hard during summer to pre-record lots of your lectures and get everything ready for when you guys are coming in. I'm sure you've noticed that the clinical skills these days is running incredibly smoothly for our senior year students, and I'm sure you have noticed that on the clinic, although things look very different to the routine you were used to before COVID, but we're getting there and our staff are doing their best to make sure you're getting the most experience out of the clinical time you've got with us. So yesterday, Wednesday, we had our first staff-student liaison committee with a number of our student reps present. Now, before I give you a glimpse of what happened on the session, I just want to give you a little gentle reminder to make sure that you guys are watching the NHS induction videos before you come along to the clinics. Now, just to make sure you know where things are, you have to go ahead and go to your normal Blackboard, and then once you're on Blackboard, you click on the BDS program, and then from the BDS program, you have to click on Universal Student Information, and when you're there is the second folder there called Clinical Induction. And you can see there are a range of topics from housekeeping to infection control to hand hygiene to chair maintenance and all the way to donning and doffing for non-AGP and AGP, and so on and so on and so on. So make sure, if you haven't done that so yet, you are familiar with all the topics over there. So moving on, please come and join me so we can watch together selected footage of the SSLC which was held yesterday.
I think Rachel's next. Hi, Rachel.
Yeah, my name's Rachel. I work with the School of Medical Sciences and I'm from the library.
Anything that you'd like to say to the guys?
Yeah, I've got just a couple of bits. It's mainly, we're trying to open as many services as we can. Obviously, we're online. As many resources as possible we've made available online. We've now got a click and collect service for books. You can book study space in the main library, the Learning Commons, and also in Stopford Library as well now. But the best place to check to see what's available is to look on our service availability page. Usually we'd have loads of activities to welcome you into the library whilst we're there, but obviously everything's a bit different now. So we've got some get started pages online for people who aren't used to using our library. And there's a couple of items there about our specialist library support and online reference and drop-ins, and there's links on there as well. So if that's something you're interested in, you can look on there.
Just one quick one. The link to book the spaces in the library, where is that? Because I know I tried to find it the other day and I couldn't find it.
Okay, so on the front page of the library webpage, there's a service availability thing, and that's basically where you can click through to everything that's available. Okay.
Fab, thank you.
But so, Kevin, if you don't mind, I've put you on the spot a bit, but would you mind sort of just giving us an overview as to where we are on everything?
Yeah. Looking at those minutes from the meeting in July, things have changed from July, and obviously things are getting a lot worse locally. But students in the 4th year going into 5th year were worried that we were well behind the drag curve in terms of getting back on clinics and seeing patients. That now is not the case, because as of today, we started doing AGPs on the clinic. whereas there are a number of schools in the UK that are not doing AGPs and are unable to do AGPs because of ventilation, etc., etc. So actually we aren't as bad off as we were in July. There are some schools that are able to do AGPs on their open clinics, but only one or two of them. So although we're not right at the front, we are certainly nowhere near the back of the queue in terms of getting on the clinic and getting on with it. So that's good news. I think all the authorities, and that means GDC, Health Education England and CopDen, from future employers and so on, are all very, very, very aware of the situation in terms of we don't know what's going to happen next week, let alone next month or going forward. However, there is a move from everyone for dental students, medical students and nursing students to be prioritised in terms of continuing with their clinical studies, because it's very important from the National Health perspective that we still have dentists, doctors and nurses going out into the workforce in September next year. GDC will be coming, well not coming, but they'll be coming virtually to check up on us to make sure that we're doing all the right things and that we've got contingency plans in place, which we have, thanks to Reza. Massive thanks to Reza and Carly, that we've got our contingency plans in terms of clinical activity and assessment in place. They may come to visit us physically in the new year, and we also need to keep people informed. All the schools have to do this, not just us, obviously, of how people are progressing, so that CopDent have an idea how many people are going to graduate in the summer, which at the moment is looking good for us, I would say, because of the amount of work our fifth years have put in as fourth years. Because I think they're an exceptional year, weren't they, Alison, from what you've told us?
Fantastic.
Yeah. Masses of experience, so that they're really starting on the front foot coming back.
And in terms of, some of the years aren't getting the same sort of experience as they would have done in the past, Reza, but you're confident that we can do our best to fill the gaps that may be here at the moment, do you think?
Certainly, because for all the other years, from January, the clinical skills will pretty much start as if it was prior to COVID. The only thing which at the moment me, Kevin and Anne-Marie are working really hard on is finding what to do with your clinics. Because we are limited by the old hospital building we've got and the air exchange rate. And we have to ensure where you want to practice is going to be safe. So it may not be physically in our dental hospital, it may be elsewhere, but there are lots of things which at the moment me, Kevin and Anne-Marie are just exploring. So we'll let you know as soon as we've got a solution for it.
Student presidents, MDS guys, have you anything you'd like to just let us all know about?
So we have a few talks coming up, which will be in the form of webinars, just on topics that have been requested so far. So we've got a BDSM Beyond kind of theme with some past recent grads that's lined up. And we also have one about the finances of being a dentist and how to talk about money with patients. So if anyone does have any more suggestions from their year group, then feel free to let us know and we'll get that arranged.
Now I've got a question for you. Did you ever have a patient who was incapable of looking after their oral hygiene themselves and they were dependent on carers or family members to help them with this? If the answer is yes, please come and join me on an interview with Professor Martin Ashley, who is one of the founders of Mouse Care Matters. Hi Martin, how are you today?
Good, thank you, Reza. Good to see you.
Now, you too. So thank you very much for accepting my invite to come and tell us a little bit about the Mouse Care Matters. So I believe you have been one of the founders of this move, and I, as well as all the Manchester Molars fans, are very curious to find out a bit more about this. So would you like to tell us a bit?
Sure, thank you. It's a good day today because something to do with Mouth Care Matters is actually going live today. We've been working with a group around the country, recognising that the way that some people can't look after their own mouth and the way that carers look after that person needs to be done. I'm going to redo that. So today's a good day for Mouth Care Matters because there's a big part of what we do is going live nationally today. We've known for quite a few years that the way that we look after our mouth is pretty good, but there's many people around the country who can't look after their own mouth because they have dementia or they've had a stroke or they've got learning difficulties. And there's millions of people in that position. And so we know that the responsibility lies with a loved one or a carer or a nurse to care for that person's mouth. And most of these people don't have the knowledge or the confidence to deliver mouth care to somebody else. And so we've got a problem there because these people then have an unhealthy mouth, and their diet and their hygiene and their ability to take medication, their self-confidence, all those things deteriorate because they haven't got a healthy mouth. So Mouth Care Matters is about teaching people to look after somebody else. And we've been doing Mouth Care Matters for about 3 or 4 years nationally now, but recently it's really come much more into focus. We've had guidance from NICE and from the CQC, specifically looking at the oral health of people in care homes and nursing homes and hospitals, raising some significant issues with those. And so this is a really good time to be working within Mouth Care Matters to recognise the benefits of that. If you'll let me, I'd like to show you a little bit about what's happening today. We've started an online learning course for people who want to who do care for somebody else and want to learn more about it. So I'm just going to share my screen.
Yes, please, Martin, because that was exactly my next question. So how this is done? Is it like face-to-face, or do you have like an online platform? So I assume this is all done online via your website. Is that correct?
That's right, yes. I've shared my screen there.
Thank you.
So the best way to teach someone how to care for somebody else is face-to-face, alongside them, with that person there, and go from a classroom situation of learning theory to practical learning at the chairside or the bedside. But there aren't enough of us capable of delivering that to be able to manage the whole workforce and the health and social care network around the country or around the world. And so we realise there's a need to leave some other methods of education that people can benefit from. And nowadays, particularly in the last 6 months, we recognise the value of distance learning and e-learning, because so many of us are doing that in order to entertain ourselves and to learn subjects as well. In the world of e-learning, there's 2 major companies that deal with that on a global scale. One of them is American-based called Coursera, and one of them is UK-based called FutureLearn, and that's the one we've chosen. FutureLearn came from the Open University, and there are thousands of short online courses that we can pick up from FutureLearn. They're all free access, which is important. They don't cost you anything. They're generally 4 to 6 weeks long, and you do some self-directed learning, normally a couple of hours a week. So we chose FutureLearn in partnership with the University of Manchester and Manchester Foundation Trust as the home for Mouth Care Matters. And what we've done is developed a 6-week course, which is largely video-based, short videos, and it's about 2 hours a week of learning. It doesn't cost anything to join the course, and you can access it at any time, and you progress through your learning over that 6-week period. The course went live this morning, but it's been accepting registrations for 10 days. There's people from 24 countries around the world who are signed into Mouth Care this morning already. It's been a huge success, more than we could ever expect it, but the content has really hit a note. As I said before, the need to care for the people to deliver mouth care, there's just nothing like this. It's not written for dentists and dental students, although we will benefit from understanding the theme. It's written for carers and nurses and doctors and speech therapists and husbands and wives and mothers and daughters who will care for someone else. So what I showed up on screen there is we can see from the top of the company is FutureLearn, and if you just go to FutureLearn on the web and just put in mouth or Mouth Care Matters, and it will show the course and then how to register. The screen you can see here is because I've already registered. I have to be registered, don't I? I've run it. But I then go to course, and we have an introduction as to what we're doing, good mouth health, and then the topics we cover. We can start anytime. This is an always open course. And then what we achieve out of it really is the knowledge and the confidence to care for somebody else. The topics were covered in the 6 weeks. The first week is the background to Mouth Care Matters, why we do it. And also for those who aren't clinically educated like we are, something about tooth decay, gum disease, and the simple things about mouth health, the basic facts. In week 2, we talk about assessing the mouth. What do we actually do when we assess someone's mouth? And then a bit more of the basic science about caring for mouths. In week 3, we talk about how do we clean someone else's mouth. Actually, what do we have to do And it's a big barrier for people, that. Week 4, we focus almost entirely on the equipment that we use, right from toothbrushes, toothpaste, mouthwash, but also if you're caring for somebody else, things like which mouth props do we use, and how do we look after people with a dry mouth or with lip problems. So a real focus on that. In week 5, we talk about adults with learning difficulties and additional needs. And we visit a house where there are residents and carers who live together, and we discuss how to look after people who have additional needs. And then as we draw the course together in week 6, we look particularly at people who have dementia, people living with dementia. What does that mean in terms of delivering care for them? And also we focus on other groups where people have difficulty. So people who have limited mouth opening, people who are having treatment for cancer, people who have problems with the way they swallow, maybe they've had a stroke or something. And so all sorts of areas where people struggle to deliver mouthcare or to receive mouthcare. So overall, over 6 weeks, we really guide the learners through what the basics of oral health knowledge, what they need to know, but then particularly in caring for somebody else. And it's mostly video based. There's a little bit of work, a bit of group working to do as well that people can dip in and out of. But I say it's free access, it doesn't cost anything, and it's a resource that's out there, and it's clearly been attractive if people from around the world have picked up on it so soon.
Thank you, Martin. It sounds all fantastic, and congratulations for having such a great first day with people from so many different countries signing up. So thank you very much, Martin, with that. Again, well done, and I will see you later.
Take care. Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye. Now, we're coming to the end of this episode of Manchester Molars. However, before I go, I need to just remind you of 2 little things. One is, if you haven't done your fit testing for the FFP3 masks yet, make sure when you turn up, you've got no facial hair whatsoever. And the second is, during these exceptional times, people can start to feel lonely and isolated. If this is the case for you, please share that with us. Dr. Rebecca Craven and Ms. Reza Smith are there to help you. Don't suffer in silence. Let us know and see how we can help you with that. So it was lovely to see you again today. Until next Thursday, I've been Reza Roudsari. You've been amazing, and look after yourselves.